Hi, my name's Pooja Aurora. I'm the freelance representative for Birmingham LMC. This video is about CQC inspections and the frequently asked questions that usually come Birmingham LMC's way when a practice has a query about CQC visits. Dr. Bill Strange and Dr. Bob Morley, our chairman and secretary, will go through each of these questions in turn, covering topics such as who's part of the CQC team, how to prepare for a visit, and what to expect once a report is announced, as well as how the LMC can help you during this whole process. Below are a few links that you may wish to look at when preparing for a CQC visit, and we hope you find this video useful.
Bob, who are the CQC?
CQC is a Care Quality Commission. That's the regulator of all health and social care in England.
And how often will they be visiting practices?
At the moment they're saying they'll visit practices every 2 years, although that could become less often as they've visited every practice once and have rated practices, and ones that are found to be good and outstanding may have their interval increased up to 5 years.
How would you advise a practice prepares for a CQC visit?
There's lots of information available both on the CQC website and also the BMA's website that tells practices what to expect and how to prepare.
I've heard that mock visits with the CCG and such can also be very useful. Who's likely to be attending on the day of the visit?
Well, the inspection teams consist of a lead inspector plus a GPC advisor, and sometimes also there may be a practice manager, perhaps a nurse advisor, and sometimes a patient representative.
Briefly, what sort of areas will they look at during their visit?
They look at the entirety of the practice activities, so both the clinical side of things, but also the managerial and admin side of things, so policies and processes and infection control procedures, that sort of thing.
Now, I know you can't get out of having a CQC visit. Can you postpone it?
Well, if the date is inappropriate, perhaps because key members of staff aren't going to be available, then you can certainly ask the CQC to rearrange, and hopefully they will be reasonable about that.
After the visit, what can a practice expect?
Well, within a few weeks they should get their draft report, which gives them their draft rating. There's also an opportunity to challenge any judgments that are made based on factual inaccuracies, so that's an opportunity for the practice to put forward any concerns it has. Now,
I guess it's at that point that a practice might consider involving the LMC in that process. Would I be right?
Certainly, if there's any difficulties with the draft rating, if it's inadequate or requires improvement, then both the CCG and the LMC should be able to help and advise the practice.
So, what type of ratings might the practice get?
Well, there's 4 ratings: outstanding, good, requires improvement, and inadequate.
And the ones that are ringing alarm bells in my mind then would be requires improvement and inadequate. What can a practice expect if they fall into either of those two categories?
Okay, well, if the final rating is inadequate, then the practice is put into what's called special measures for a period of 6 months. It has to make changes, and then after a period of 6 months the CQC re-inspects, and it needs to see that the rating has improved.
And requires improvement?
Similarly with requires improvement, the CQC would expect to see that rating also had improved to good when they re-inspect in 6 or 12 months.
What type of help can the practices expect to receive in achieving this level of improvement?
Well, firstly, we'd recommend that all these practices seek LMC advice, and we work closely with the CCG, which will also be able to assist. And there is a formal programme of support available from the Royal College of General Practitioners. The CCG will fund half of that support, with the practice is expected to pay the other half.
Ultimately, what can happen to a practice if they fail to achieve?
The worst case scenario is if an inadequate practice isn't able to improve, that the CQC can actually put it out of business by terminating its registration. Short of that, there are conditions that can be put on the practices registration as well.
Have we seen many practices having their contracts terminated in Birmingham?
Not in Birmingham, no practices have closed down as a direct result of the CQC process, but there have been a small number in other parts of the country that have been closed down.
Now, I know from my personal experience, a CQC visit is very stressful, and also my colleagues tell me that. Who pays for the process?
I'm afraid that GPs have to pay it themselves through the annual registration fee.
It seems to me that on the day, the CQC can look at practically anything. In particular, I've heard from some of my colleagues that you can have an inspector who goes rogue. Have you had any experience of that?
We've had lots of complaints both about the attitude of certain inspectors and also about the unreasonableness of some of the questions they've asked and the decisions they've come to.
What would your advice be to a constituent who thinks that the CQC is asking things that go above and beyond what's reasonable?
Well, first of all, ask the LMC for advice on this matter, and if there's a genuine issue there, then there is a formal complaints process.
Perhaps I could conclude, Bob, by just saying, what's your personal view on the CQC and the future of the CQC?
My personal view is the CQC process is not fit for purpose. It's taken a sledgehammer to crack a nut. We know even from the CQC's processes that only 4%, a very tiny minority of practices, are found to be inadequate, and yet every single practice has to go through this hugely bureaucratic, time-consuming and very stressful process. There are mechanisms already in place, contractual mechanisms and professional regulatory mechanisms by which we can assure the quality of general practice. We don't have a CQC in Scotland, Wales and Northern Ireland, as I mentioned earlier, and I don't feel there's a need for it in general practice in England either. We can do other things better and they can be far more fit for purpose.
Well, I certainly found my CQC visit, as you know, very stressful, Bob. Thank you.